Hi, I'm Dr. Kaplan from Helios Telemedicine for Men, and today's topic is testosterone deficiency therapy and infertility. So you've been diagnosed with symptomatic testosterone deficiency, also known as male hypogonadism, and you've been told that the treatment can cause infertility and you want to have kids. Okay, so this is how it works. Their Sertoli cells in the testes make sperm based on the stimulation of follicle stimulating hormone, FSH, from the pituitary gland and the testosterone level inside the testes as stimulated by the luteinizing hormone from the pituitary gland as well. Testosterone replacement therapy essentially turns off this LH and FSH, reducing the stimulation on the testes to make sperm. So what's a guy to do? If you've watched our prior videos, you know that you may have secondary hypogonadism or a mild form of the primary testosterone deficiency. If that is the case, your clinician may recommend a medication called Clomid, which blocks estrogen receptors in the hypothalamus, allowing it to continue or increase its stimulation of the hypothalamic pituitary testis axis and might be able to raise your testosterone levels enough to relieve the symptoms without increasing the risk of therapy-induced infertility. We could also try human chorionic gonadotropin. HCG is a hormone produced by the placenta to stimulate the uterus during pregnancy. When it is injected in men, it simulates LH and FSH, stimulating testosterone production and preserving fertility. So what can you do if you have to go on testosterone replacement therapy? Some physicians recommend getting a semen analysis and potentially freezing sperm prior to testosterone replacement therapy. While this seems drastic and is expensive, it gives you the best chance of parenthood if you do develop a lower sperm count while on testosterone. The sperm count or quality doesn't always go down on testosterone, and it usually recovers once testosterone is stopped, but it doesn't always. There are also things we can do to preserve spermatogenesis while on testosterone replacement therapy. We can give HCG, which may preserve fertility even if it doesn't relieve all the symptoms of testosterone deficiency. Also, as the testosterone levels in the body rise, there is more available to the fat cells for conversion into estradiol. Estradiol attaches to receptors in the hypothalamus, preventing it from releasing GnRF. This means less stimulation on the pituitary gland and less sex hormone release. We can use a medication called Clomid, to block the receptors in the hypothalamus, allowing it to stimulate LH and FSH production and release by the pituitary gland. We can also try to using an aromatase inhibitor like anastrozole or DIM to block the aromatase enzymes in the fat cells from converting testosterone into estrogen in the first place. If you cannot conceive and a semen analysis shows that your sperm count did go down on medically supervised testosterone replacement therapy, the sperm count usually does recover once we stop testosterone. It might take as long as a year, but it usually does for most men. If it doesn't recover, then you will likely be referred to a fertility specialist who might try much larger doses of HCG or Clomid than is usually given in a men's health clinic. They may also try medications which contain LH and or FSH, or a medication called human menopausal gonadotropin, which simulates FSH. These are usually much more expensive and reserved for men whose infertility is unresponsive to other regimens. They usually have good success at establishing pregnancy whether through the natural way or through a procedural process. It is in the self-medicators, those who get their anabolic steroids from their friend, buddy at the gym, or online, in whom they have the lowest success rates. Our next video will be an attempt to recap everything that we've talked about so far and tie it all together. In the meantime, check us out on Helios Telemedicine for Men, where you can see our prior videos and blog posts, take a self-assessment questionnaire, or make an appointment to see me. You can follow us on YouTube, Facebook, and Instagram at Helios Telemedicine for Men. Thank you for your time and attention. Bye for now.